civilian from the Navy, and we're getting a lot of these patients because of the Iraqi situation. The Navy hospital is just overloaded. But he has this kind of myofascial syndrome. He said very extensive workup, neurology workup, MRIs, his brain, his spinal cord, very little findings. So we're using music therapy here. One, we use it for several reasons. One, to help relieve pain. We know that music can help increase your endorphins. I want you to focus on the music, so hopefully this won't hurt you too much. Little ouch, 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 ouch. Just focus on the music, forget about the injection. Ouch, 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 ouch. Yeah, here's some nice, beautiful music playing in the background. Ouch, ouch, ouch.
This helped a lot because it gave me something to focus on and kind of took my mind off things while I was getting the injection, so it relaxed me a bit more.
We often get the question, what do music therapists do in the medical setting? Doctors and nurses refer patients for pain or anxiety management, nausea management, lots of different goal areas. So we go in and use music as a therapeutic medium or tool to help achieve those areas through songwriting, lyric analysis, relaxation. Music therapy is a really effective method of using music as an emotional expressive tool, talking about coping strategies with your illness. It's also a great way to just divert your attention and normalize the environment. So the sounds of the beeping, the nurses talking, phones ringing off the hook, music really just normalizes that environment, something familiar, because we're using client-preferred music. That is very important.
We're going to do a nerve block today in the areas where she has her spasm, but in addition we're going to use music therapy to reduce the amount of medication that we have to give her pre-procedure and post-procedure. Just putting some medicine where you're tight. Seem to be tight on both sides.
Music therapy is an evidence-based practice. We use both objective and subjective measures to see how a patient is doing and whether the benefit of the goal is being met. So we check things like vitals, whether that's the blood pressure, heart rate, breathing rate, respiratory, how much the oxygen saturation levels are affected. We take that pre-session and post-session, and then our subjective way is just asking the patient, how do you feel today on a scale of 0 to 10? Where's your pain?